Question. Dani was given Dilaudid for pain. She is sleeping and her respiratory rate is 4 breaths per minute. If action is not taken quickly, she might have which of the following reactions? Asthma attack, respiratory arrest, be pissed about receiving Narcans, wake up on her own. Correct answer is B, respiratory arrest. Rationally, narcotic can cause respiratory arrest if given in large quantities. It's unlikely Dani will have an asthma attack or wake up on her own. She might be pissed for a minute, but then she would be grateful for saving her butt. Question. Which of the following additional assessment data should immediately be gathered to determine the status of a client with a respiratory rate of 4 breaths per minute? Arterial blood gas ABG and breath sounds, level of consciousness and a pulse oximetry value, breath sounds and reflexes, pulse oximetry value and heart sounds. Correct answer is level of consciousness and a pulse oximetry value. Rationally, first the nurse should attempt to rouse the client because this should increase the client's respiratory rate. If available, a spot pulse oximetry check should be done and breath sounds should be checked. Patient should be notified immediately if of the findings. He will probably order ABG analysis to determine specific carbon dioxide and oxygen levels, which will indicate the effectiveness for ventilation. Reflexes and heart sound will be part of the more extensive examination done after these initial actions are completed. Question. A client is in danger of a respiratory arrest following the administration of a narcotic analgesic and atrial blood gas value is obtained. The nurse would expect to partial pressure of CO2 to be which of the following values? 15 mm of Hg, 30 mm of Hg, 40 mm of Hg or 80 mm of Hg. The right answer is D, that is 80 mm of Hg. Rationally, a client about to go into respiratory arrest will have insufficient ventilation and will be retaining carbon dioxide. The value expected would be around 80 mm of Hg. All other values are lower than expected. Question. A client has started a new drug for hypertension. 30 minutes after he takes the drug, he develops chest tightness and becomes short of breath and tachypnic. He has a decreased level of consciousness. These signs may indicate which of the following condition? Asthma attack, pulmonary embolism, respiratory failure and rheumatoid arthritis. So correct answer is C, respiratory failure. Rationally, the client was reacting to the drug with respiratory signs of impending anaphylaxis, which could lead to eventual respiratory failure. Although the signs are also related to an asthma attack or a pulmonary embolism, consider the new drug first. Rheumatoid arthritis does not manifest these signs. Question. Following the initial care of a client with asthma and impending anaphylaxis from hypersensitivity to a drug, the nurse should take which of the following steps next? Administer beta-adrenergic blockers, administer bronchodilators, obtain serum electrolyte levels, have the client lie flat in the bed. So, the correct answer is B, administer bronchodilators. Rationally, bronchodilators would help open the client's airway and improve his oxygenation status. Beta-adrenergic blockers are not indicated in the management of asthma because they may cause bronchospasm. Obtaining laboratory values would not be done on an emergency basis, and having the client lie flat in the bed could worsen his ability to breathe.